And then in about 30 seconds, Ricky's going to start. So here we go.
30 seconds or thought?
Go ahead.
Oh, okay, cool. All right, well, give everybody that opportunity now to hit record or hit mute while somebody else is hitting record. I think Amanda's hitting record, like Melissa said.
Like,
perfect.
Yep, it's recording.
Yeah, fantastic. So, yeah, this is my first webinar, at least as a presenter. I've been able to sit and watch things and do, take advantage of technology for my continuing education. And so this is cool. It's a little bit different for me because I'm not used to talking to a room of myself. I guess I might be used to talking to myself, but let's just move on from that. Now I get to introduce myself. Anyway, I'm Ricky Rodriguez. I am the athletic trainer for Springfield High School here in Springfield, Oregon, which is part of the greater Eugene-Springfield area, located near the University of Oregon. So if you notice on occasion that I might move into a southern drawl, it's because I'm originally from Arkansas, and yes, I'm wearing shoes so for my presentation. But anyway, so originally from Arkansas, it's been the last several years moving around the country, but have settled in this great state that we call here of Oregon. So, like I said, I'm the athletic trainer there. My background includes having a master's in education. I'm also a strength and conditioning specialist, and here in Oregon, I'm one of our OSAs, which is our state governing body for high school athletics, impact train athletic trainers. So has to do with that test, and I'll talk a little bit about that. This is exciting because I get an opportunity to talk to a lot of different professionals, whether it's educators, administrators, other healthcare professionals, researchers, and let them know a little bit about what I do as an athletic trainer, which is, it can be tough for my group, and I'll talk about that why a little bit, because we're a bit of a can be a misunderstood profession because the name itself, athletic trainer, can be quite confusing, and I'll talk about that a little bit. So this is just a great opportunity, especially for a month right now in September, where we're getting ready as my profession to do a lot of awareness when it comes to safety in sport, and that I feel athletic trainers are right there in that front line working on promoting that. So I think it'll be a good time. So I'm glad you guys are here. My presentation is not moving. Oh, I just hit click. Perfect. All right, so disclosures. I have none. I have no financial disclosures, but every time I go to a cool presentation, the doctor stands up there and they say that they have some or have none, but I have none. And if anybody wants to send some money my way, I'll gladly disclose that financially, which I would. Anyway, moving on. Who I am. Again, I in the Springfield High School, the home of the Millers, athletic trainer. Been there since 2004. Prior to that, I spent time at Oregon Health Science University, OHSU in Portland, down at the Center for Health and Healing, working in our rehab services department down there, which had housed our sports medicine area, housed the head athletic trainer working with several, or the lead athletic trainer working with several athletic trainers, providing patient care there and providing some outreach athletic training services to the surrounding schools in the Portland metropolitan. Prior to that, I had a short stint as an umpire in minor league baseball, and I'll get to why that's important in a little bit, besides it just being a cool job and traveling the country calling balls and strikes. And before that, I spent several years, or 3 years at Willamette High School before I moved around. And that's where I kind of cut my teeth as a secondary school athletic trainer, and had some great opportunities right when our world of concussion management was changing. So that little bit of time is really important and help kind of create who I am and how my outlook on concussions has been over the last decade, and the way it's evolving yearly, sometimes weekly, every time we have new exciting things coming out. And sometimes if it's easy to say that athletic trainers can sometimes be nerds about concussions because we see a lot of them, we deal with a lot of them, and we're the first person to see them often. Any of you, so these are kind of my, I don't want to say they're goals, but it's a bit of my overview of what I want to go over today. I want to talk about exactly what is an athletic trainer, and I am not the physician, I'm not the researcher, I'm not the PT, the different people that you guys have been able to bring in and talk about these, or the lawyer, the legal issues. What is an athletic trainer? Because when it comes down to it, the athletic trainers are the people that are seeing a ton of these concussions and being the person who is dealing with them and being that kind of liaison between everything. I wanted to be able to talk about and a little bit of review, because I know you guys have seen a lot of different webinars that Seabird's been able to put through and look through the slides. But if you're here and you don't know what a concussion is, it'd be very surprising. But I'm gonna give a little bit of review of what's a little bit different about sports-related concussions, what the role of an athletic trainer is for those sports-related concussions, and especially like what's the school-based concussion management team? Why is that important? How is my team working? And why do we do that? Why is that important? And maybe, what can we do moving forward with concussions in the classroom or on the field, or just as a team? Anyway, so I'm going to start off with a little bit of perspective, and I talked about being an umpire in professional baseball. Here's a little cool picture of this is our local minor league baseball team's field here at the University of Oregon. This is the Eugene Emeralds, who just won the Northwest League Championship about a week and a half ago. And if you like baseball and you want to see a really weird way to win a championship, look them up, because they just went on a walk-off block. And yes, I'm going to talk about sports on occasion because it's where I work. I deal with a lot of sports. Okay, so here's our injury. We're going to start straight off into a case scenario, a little scenario here. Okay, August 15th, 2010. We're in Boise, Idaho. We have the Boise Hawks and the Everett Aqua Sox of the Northwest League. So we have a baseball game going. We have a foul ball that goes off the mask of the umpire. So foul ball goes directly off the mask, knocks the mask off the umpire. Umpire stands there, picks up the mask, puts it back on, puts the ball back in play. No issues. However, the umpire is having some difficulties concentrating and tracking the baseball. He's attended by the athletic trainer by the Hawks. Athletic trainer comes out, asks him how he's doing. At the moment, that athletic trainer says, "I'm absolutely fine. I have no issues." However, he is removed from play roughly an inning later because of the fact that he's having difficulties concentrating and tracking the baseball. Here's a good example of somebody who knows they're hurt, but does not want to stop what they're doing, because right now this is their job. It's very similar to a baseball player or a football player, a soccer player who has I would quote unquote say job, or something they are supposed to be doing. They're supposed to be playing in this game. They have responsibilities. They don't want to let their teammate down. In the example of this umpire, their crew member, they don't want to let their crew down, because when one umpire goes down, other people have to take up those responsibilities, and it makes things a lot harder. So this person doesn't want to do that. However, they have maybe an inning or so later, because when pitchers are coming down the plate, they can't call balls and strikes because they don't really know what's going on. So what happens with this person? The person's taken out of the game. The next day, follow-up evaluation with the team physician for Boise. Post-injury, they take an impact test. They do it several times over the next several weeks. That person stays out for the last few weeks of the season. Sent from Seattle on a flight all the way to Pittsburgh, to the University of Pittsburgh Medical Center, UPMC, which has been for a long time a very big leader when it comes to concussion management research. They, at the time, were seeing all minor league baseball umpires for their injury. So a red-eye flight over there to see a DO, a neuropsych, a physical therapist to see their injury. Ended up starting some vestibular therapy with the PT there. Ended up having some drugs prescribed, some amantadine for that person, and so that was in August, and that umpire wasn't cleared until May 2011. So it was a good amount of time there for a concussion. We have an August to May clearance, and so that a little bit, and let me back it up a little bit, is my perspective as me being the patient as an umpire. And I probably didn't say this was me, it was an umpire, but this was my experience when I, being an athletic trainer, doing a different job as a professional umpire, knowing better, being trained, knowing that, hey, I'm not supposed to keep playing or keep working right now because I just got a head injury and I don't feel right. and being stubborn enough because I can't make that decision myself, having had the athletic trainer come and take me out of the game because I can't make those decisions when I sure as heck know better because I'm trained to know better. However, my professional career ended due to that same injury. I worked the next season, and during that season, I still had some vestibular symptoms that would come up on occasion. And so working, and here's some cool pictures, and it changes my perspective. So due to those symptoms that were just lingering, that were just eye fatigue, a little bit of vertigo kind of symptoms on occasion when on the field, motion sickness, those things with talking to family and physicians, it was time to go ahead and stop the baseball career. Again, stubborn like a lot of people, didn't mean I wanted to stop working baseball, so I continued with Division I NCAA baseball for a few years, and in a regional game in the playoffs, and I had another concussion happen, and I have not worked a game since then. I don't have lingering symptoms from that second one. Nothing's changed after that one, but that one happened, and I didn't feel good. I didn't feel good after that, and it was time to say, you know what, it's time to move on to something that's a little bit smarter for me, because I have a different, like I said, here's the perspective, because I have these two cute kids right here, Eli and Joey, and my wife, Billy Joe. And it was time to move a different direction. So that's my perspective. I have the perspective a little bit of being the athletic trainer, and you know what? Someone being that patient that had trouble getting back, the patient that had months of symptoms, the patient that had to go to vestibular rehab, a patient that had to change lifestyles quite a bit, go through a little bit of anxiety toward it, go through some depression behind it, and just go through, I think, the whole gamut of what it can be like sometimes to have difficulty going to work because I'm having these things, difficulty taking classes, sitting in front of a computer when I needed to do work, just having the lifestyle change a bit. But at the same time, I've been super fortunate because I haven't had to go through long-term life-changing effects. The long-term effects, I've been fortunate with those things. But do I still have some stuff? Yeah, I get motion sick easier than I used to be. I can't stare at a screen like I used to be, but these are small little things that I'm fortunate that I can say I can still do, where a lot of people still struggle with every day. Okay, so moving on, what's an athletic trainer? So if I have a group of people here, and some of you are scratching your head, go, why is a person who works in a gym tell me about concussions? I can try to say that, hey, not personal trainer, athletic trainer. Why is it an athletic trainer? I don't know. The history of our profession has been weird. It's a profession that long ago in a traditional setting, when it comes around collegiate sports, being excuse me, sorry, I have to hit some Facebook notifications, being a healthcare provider that's just slowly evolved into what we are now. And it's an incredible field. It's a great, passionate group of people who are just there for the health and safety of our student athletes or our patients. What do we do? We specialize in injury prevention, examination, diagnosis, treatment, rehab. These are the areas that we really work hard and strive to take care of people, take care of our athletes. This picture down here is just simply my small facility. It's not grand by any scale, but often it's clean, and often it sees a lot of kids every single day, and a lot of kids who are working hard, who are highly motivated to get back to play, and that helps me be highly motivated to get them back to play as safe as possible and as quick as we sometimes can. But keeping perspective, keeping them knowing that these are high school kids, and my perspective is going to be based around the secondary schools, because I have no experience since as a athletic training student in college. I don't have a perspective for for collegiate athletics anymore. Nor do I work in a middle school or work with youth athletes. But I can give some small ideas around these areas. But most of my background is going to be surrounded around secondary schools. So anyway, yeah, kids come in here, and roughly you got to look at what an athletic trainer deals with every day. I have roughly, and this is me just being a smaller school. There's scales of schools that have a lot more athletes and scales that have a lot less. But I'm right there in the middle, and I might have roughly an estimate around 200 athletes right now in season, between football, volleyball, cross country, boys and girls soccer. Yeah, that sounds what I have right now. So that's roughly 200 kids. And maybe I have 15 come in right after school that I have to deal with and bounce from, and try to manage my time and do rehab and do some evaluations on them. and work through these things really quickly every single day. And hopefully, if I had all 200 show up at once, I'd be in a lot of trouble. But 15 is enough to have to deal with at one time anyway. Moving on. So again, we work in a lot of different settings. We have traditional settings. Here's an example of an athletic trainer at the University of Oregon. We have traditional settings, which is usually sports. We have non-traditional settings. You can go to Amazon and you might have an athletic trainer working in their factories, working with ergonomics, working with injuries that might happen on the job, just trying to keep these people safe. You have athletic trainers who work in clinics, and I've worked at, like I said, I worked at OHSU and I worked with patients there in clinics. You have athletic trainers that work in somewhat of a what we used to call a physician extender role in orthopedic clinics or those different things. There's a lot of different areas that athletic trainers work in, but again, our traditional settings in our athletic departments, which is a little bit different. And you talk about a lot of, I mean, especially with news right now, with recent deaths, recent injuries that are just getting a lot of, I'd say a lot of media coverage in the last few weeks. The athletic trainers, for the most part, they work within the athletic department, but they don't necessarily work for the coaches. So if you have an athletic trainer who's, for me, for an example, working at Springfield, I'm on the athletic staff. Me and my athletic director are on the athletic staff. Our athletic secretary is on the athletic staff, but I don't answer to my head football coach. I don't answer to my head soccer coach. I work alongside these people and provide recommendations and oversight, and they listen to me and what the decisions I have to make medically, because it's not their responsibility. Like I said, we're here for the health and safety for those kids, and it's a fantastic area. Again, responsibilities. I'm quickly go through this stuff because I want to get to the good stuff. We're going to oversee a lot of the athletics, whether it comes to physicals, history, return to play. And the reason I'm kind of getting into this because I want people to understand what we do, and I think it's important. We are going to evaluate both chronic acute injuries. We do a lot of different taping, bracing kind of things. I do a lot less than people would expect. People think, hey, you doing a lot of taping right now? No, I'm doing a ton of rehab though. I'm doing a lot of triage on the massive amount of soccer injuries I have right now. But yeah, not a lot of taping as much as people would really think. Ton of documentation. I have to spend hours a day breaking down charts and working on documentations. I do a lot of this, just the doctor referrals, getting people to see the right person in order to get them to play. And I think there's a huge area that gets left off when it comes to athletic trainers. It's this gatekeeper kind of role that we have, where we're saving parents and school districts money by being able to see us first and making determinations on what kid really needs to go to the emergency room, what kid needs to be referred off to an orthopedist, what kid needs to go to urgent care, because what happens is when we don't have somebody in this role, every kid goes off to urgent care, every kid goes off to emergency room, and then we have lost school time, we have lost seat time, we have billing issues, we have kids whose parents are taking off work, we have co-pays, and really for often unnecessary things. So it's a super awesome opportunity to have athletic trainers in the schools to take care of those things. A lot of emergency action planning, and that comes down to concussion stuff too. So putting policies in order to make sure that we're facilitating emergencies in the correct way. I do a lot of CPR, first aid instruction for my staffs. I'm here for all of our practices and games. I deal with environmental concerns, whether it might be air quality, whether it's lightning. We're having the West, if you don't know, it's on fire right now. And if I'm talking to somebody from Boston, or I'm talking to somebody from the East Coast, I mean, they're underwater. So we kind of, everything's all over the place. But we deal with environmental concerns. Like I said, the West is on fire, so we have to deal with maybe shortening. We have to change game times and practices and stop practices due to those things, due to smoke sometimes, lightning, and all kinds of other heat illnesses, those things. But when it comes down to concussion management education, honestly, like, I watch this list just grow every year, like more and more stuff that I deal with when it comes to concussions over the last several years. Whether it comes to teaching coaches, I have coaches who are going to have formal education online every single year because it's a mandate for them. But sometimes getting in front of them and talking and teaching, working on helmet fitting, and not saying that helmets are the end all, the thing that's going to stop concussions, because if you want to go get the holy grail, go invent invent a helmet that prevents concussions, because you're not going to do it. Creating policies. Who's creating your policy when it comes to concussion management for your high school? Is it the athletic trainer? Do you have an athletic trainer? It's probably not going to be your head coach and your AD. So who's creating these things? Do you have a policy? And we'll get to those things. A lot of data collection when it comes to concussions, baseline testing when it comes to like impact test or other neurocognitive testing or balance or sway stuff. There's all kinds of stuff out there. Diagnosis, I can diagnose concussions on the sidelines. Oops, let me go back. Referring these people to the right person, because yes, sometimes I need kids to see their primary care physician. Sometimes we need to get them to a concussion specialist, and sometimes I'm pretty good at helping those things out. Return to play protocol, which is super huge, and we'll get to those, and big part of our TBI team here on campus. All right, so sports-related concussion, let me look at my clock. All right, sports-related concussion, there's been a huge paradigm shift over the last decade, especially when we come to diagnosing concussions and managing concussions. And when I say like diagnosing, like, yeah, I would say there's been a big shift of diagnosis. Why? And I can look at we'll look at numbers in a little bit, but how we manage them is night and day different than how we were when I started this. And gosh, I haven't been doing this that long, to be honest with you. 2005 was my first year working as a licensed board certified athletic trainer in the state of Oregon. And when I got here, and this is throughout the country, everybody, what we were doing in 2005 and what we were doing in 2009 compared to what we're doing in 2018, it's a lot different. It's changed so much. And you want to talk about medicine, talk about paradigm shifts in education, it takes forever. But what we've got now the last decade has been huge. So and I'm not going to harp on it forever, but I think it's important to understand that there's old school mentalities on concussion. There's this old school concussion scales that we used to grade everything, a 1, a 2, a 3. We really relied a lot on loss of consciousness. How long was that? Was there a loss of consciousness? How long was that loss of consciousness? And then, well, when did their symptoms go away? So those are things, like an example would be 2006. I had a kid who got a concussion. I think it was 2006. I'm just giving a rough estimate. 2006, you have a kid who has a concussion, no loss of consciousness, and their symptoms resolve within 15 minutes. Back in the old school scale, that's a kid who's qualified to return to play that same day, and that's at that time. That was a long time, and that's roughly 15 years ago. So that was the old way of doing things. And what happened was that delayed. We would have kids the next day show up, or 2 days later showing up with symptoms returned and elevated, with drawn out return to play now because they have their symptoms have worsened. So what happened around roughly 2004, I think it was 2004. I have it here. It says 2004, so it makes sense to be 2004. The Prague conference, we get all these super smart professionals throughout the world, and they get together in all these fancy places like Prague and Zurich and Berlin and Belfast, probably, these fancy places to get together and talk about concussions. What happened in 2004 is they got rid of all these old scales and old ways and put in some important things. They started to grade them differently. They put in a standard way to assess things. They created a document for standard assessment instead of everybody having their own way to determine concussions. They created a guided way of a stepwise return to play criteria, which was super great because how compared to it was in the past. Now we have some structure. What we created was structure in 2004, and the big thing is we now are not letting people return to play the same day. And since then, since 2004, we've had multiple updates. Zurich, Berlin, the most recent one I think was Berlin's, and they got rid of grading them altogether. They've updated that standard assessment tool, what we call now is the SCAT-5, and they every time they look, and what's great about this evolving science is they looked at what's right, what's working, what's not working, and they evolve. And we're evolving to a world where we're starting to change how much we're resting people and getting rid of the dark room stuff and moving on. So anyway, so that's what's happening with sports-related concussions the last several years. So what's happened for people who are the parents, the people watching TV, the researchers in the world, they get bombarded with all this. And yeah, yes, I know this is a highly used picture of a iceberg that is in every presentation when it comes to everything, but it speaks volumes. So bear with me as my first webinar. I'm going to use it. Large amount of media attention when it comes to concussions. Why? Well, we had that Will Smith movie of concussion. We have these CTE diagnoses, and we have these NFL players and the suicide rates and all these things that are going on that get a lot of media attention. And so we start paying attention to concussions when it comes to professional athletes. Yet, and again, here's my iceberg, there's so few of those people, yet last year there was nearly 8 million kids who participated in high school sports, and that's just high school sports. There's a large amount of kids who play middle school sports that stop playing by the time they get to high school. There's a lot more of those kids who play youth sports. So the professional sports where we're recognizing, oh, we have to have the best care, we have to have all these policies put in place. We started to have a little bit of a trickle down to our youth, our secondary school athletes. Because why? Because that's where we have to get ahead of things. That's where we need to advocate for those people. People are going to advocate, lawyers themselves, people are going to advocate for the professional sports different and college sports differently. We as educators, as athletic trainers, as teachers, as administrators, as athletic directors, as parents have to advocate for everybody else. So you know, here's some different things. What we've seen legislation go into effect, and I know Washington was the first one to put in their concussion law in our great country. Oregon was shortly after that with Max's law, and the Max's law thing, and like a short little thing, Max's law, when we put in, this is kind of mandating coach training, mandates no return to same day return to play, medical clearance by a professional. Jenna's law came a few years later, and that's more for club, youth, private school things. But now I think all 50 in District of Columbia all have their own, and it took a while to get that really going. And what happens is sometimes the state associations were ahead of those things. Like I believe OSA, what we wanted to do is we wanted to put these best practices in place before somebody who doesn't know what best practices are comes up with legislation. But the good news is legislation can be super helpful. Like the Max's law, for example, make sure our coaches are doing these things. So that has been super helpful. Does it take a tragedy to get these things? Yeah, it does. Unfortunately, we're very passive when it comes to these things. We wait for something to happen, unfortunately. So that's something else I like about my profession. My profession tries to be athletic trainers working alongside with other professionals like yourselves, work hard to try to get ahead of things and plan for these things and put in best practices so we can prevent these things from happening. Okay, high school data Rio. So football, look, and just looking at concussions, here we go again, talking about sports-related concussions. You know, roughly around 2005, 2006, we're getting about 4.5, and this is a slide I'm stealing from Dr. Keister, who gave a presentation last year. This is actually not the whole slide, but part of it. This is Rio data. I provide Rio data. A lot of athletic trainers around the country provide Rio data, and we consider athletic exposures like one practice, that person, one game, that person, that's exposure. So every 10,000, back in 05, 06, we had 4.5 concussions every 10,000 exposures. Moving closer now, we have 10.5, so we had an increase. Is that because, is that because we have more concussions? No, I don't think we have more concussions. I think we have more diagnoses of concussions. We have more athletic trainers, better able and more qualified for diagnosing concussions, and with this paradigm shift of the new standards, whether it's the National Athletic Trainers Association position, their position statement on concussion, whether it's the international, when I talked about with Berlin, their last conference, you know, we have more recognition of what's going on. We have athletic trainers out there advocating, identifying concussions a lot better. So that's just football, and you know, people are going to talk about football left and right, and I'll say that football, yes, there's a high concussion rate for football compared to other sports. But let's just look at soccer. We have girls soccer, 9.1 for every 10,000. So that's right there beside football. Yet boys soccer has a rate of 4.2. And it's not just a football thing. It's what I want to get out there, that we're not just worried about concussions when it comes to football. I have right now the 4 that I've had this season. 2 have been volleyball. 2 have been football. None have been girls soccer yet. Hopefully I don't have any, but it's all over the place. And so just understand it's not just a football thing. So what's different now too, what's starting to change is I'm getting a lot more coach and parent education. Yeah, man, and that's best practices. I mean, to be honest with you, yes, it's state mandated that my coach needs to have training on it. But you know, it's best practices that the parents have understanding of concussions, that the kids have understanding of concussions, because the amount of time that me as an athletic trainer, I've had a kid come up to me themselves and say, "Hey, Ricky, I'm not feeling that good. Can you look at me for a concussion?" You know, it might happen every few, but you know what? A teammate tells me, "Hey, Ricky, you might need to take a look at Johnny over there. He doesn't look right." Or a coach come over, "Hey, Ricky, will you take a look at Johnny? I think you might have got dinged," and I'm saying that word loosely. So you know, when I get kids and coaches and parents who understand what it looks like, that moment that kids are going to have a hard time coming and saying something to me. Again, I'm using myself as an example. I don't want to let other people down. I don't want to come out of the game, but other people look out for each other, and it's been great. So I get, you know, past experiences. So what happens with I get more and more coaches who are familiar with the standard of care. Why? Because this shift has been happening over the last decade or so. They're getting used to it. It's not a sudden surprise that we're going to have this kid out for this long for their concussion, and they're having this graded return to play that I'll talk about a little bit. I get less pushback from it because honestly, it scares a lot of people. It scares my coaches. They don't want to get caught up in it, and they know they have somebody else who's going to take that off them. They have their athletic trainer who's bearing that burden, who's working on with that kid, and they can move on and do their job. I have parents who have had kids who had injuries in the past, so they're now getting used to it. A new parent, this first time their kids had a concussion, yeah, they might not be as familiar with it. They may have had some parent training and seen watched a course on it to understand. But if I have a kid whose kid graduated 3 years ago who had a concussion, and Johnny comes in and he's a freshman and he got one, or his sister had one, they understand what we're kind of doing, and so it's going a little bit better that way. But I also have coaches who's had their own experiences, who played at a time when they had multiple in college and no one was speaking up for them, and they couldn't go anywhere for it, and they had this numbness in their head every single day throughout most of the season, and would throw up after games because they felt awful, and they don't want to do that to a kid. It's not that they're worried about getting in trouble because they played a kid. No, they don't want kids to suffer and go through what they had to go through because nobody cared enough, or no one knew or was educated at the time enough to advocate for them. So I have coaches that care, and that's fantastic. I would have a different job and a different perspective on life if I had my coaches who didn't respect what I did, and at the same time didn't care for the kids the way they really do. If it comes down to it, you get the coach who's a bully sometimes. You know what? I don't see those guys as much. I'm seeing the coaches who are there for kids, advocating, working hard, and want the safety just as much as I do. So again, with sports-related concussions, we have this response in athletics. What's athletics doing for concussions? Because you know what, it's important, because it's a big part of what's going on. So we're getting more. I feel that there's a growing presence of athletic trainers, more than there was so when I started this. And like I said, it's been since 2005. When I left Arkansas, there's a handful of on-staff athletic trainers. There was some clinical outreach athletic trainers, and if there's anybody from Arkansas here, hey, how you doing? Woo Pig Suey, although they're not doing well. Anyway, what's changed now is there's been a huge push for having athletic trainers in the high schools in Arkansas. It's been great being on the outside, seeing that happen. When I got into the profession, I had a mentor named Jason Cates, who ended up at Cabot High School in Cabot, Arkansas, who had a new athletic director, and the athletic director asked him, "Hey, who's the athletic trainer here?" "Oh, they don't have one." Well, that's not a facility. That's not a program that I'm going to have happen. I'm not going to have a program that's not going to have athletic trainers and doesn't care for the kids the right way. So what happened? This is a high school that hired a head athletic trainer, hired a few more, and now has a staff, I believe, of 4 to 5 full-time athletic trainers dealing with a high school that's at every practice, every sporting event, working together, providing best practices, providing an awesome standard of care. And what did that do? Other schools looked, well, if Cabot, who's a super successful program in sports, is doing it, well, heck, we probably should be doing it too. And what happened? We see this huge growing of safety in sport happening in states like that. And it's just one story. It's just one place, but it's a growing presence. We get more education for coaches. We have more education for parents. We have education for officials. Our officials have to go through education, understanding what a concussion is, signs and symptoms, and recognizing it. And if something happens, it's also their job to stop a game and get a coach's attention. Hey, you're going to have to get Johnny looked at. He's not coming back in right now. We're afraid he might have a concussion. Equipment changes. We're getting a lot more helmet safety. Again, holy grail, it's not going to prevent concussions, but we're getting some changes there. We're getting player safety programs, or kids and coaches are learning proper ways to tackle and taking the head out of the game so much, which is, I think, a huge part of things. And policies and procedures. We're now having these policies and procedures in schools, which is important. Okay, I'm gonna have to go fast because I'm talking a lot and I don't have a lot of time. Why an athletic trainer? Okay, we have professional expertise. We deal with them all the time. We know our patients. We know our athletes. Why? Because I'm there every single day getting to know that kid. I might know about their school. I might know about their home life, their family, their athletics. It's a relationship, and it's great. We work along other people in the high school context. I work along. I'm on staff with my school, so I know my counselors, I know my teachers, I know my administrators, I know my coaches. I have relationships with physicians in the area, professional relationships there where I can refer people out, and I know the best people when it comes to concussion management. I'm trusted by them. Why am I trusted? I feel I'm trusted by them because I'm just able to connect with them because I know them and I see them every single day, and I provide care. Maybe I provided care for your kid's ankle, and I got them back to play in time for that big game by working super hard and doing all this rehab and everything. I might have bought some respect from that person, so when I come to talk about their head, they've already bought in on it. We're there. We're battling that front lines with concussion management and recognition, and doing it every single day. We help with the identification and screening of it. And what happens when we're there and we're able to see it firsthand, it's much more likely to have a sideline diagnosis. If I have a kid who bumps their head and nobody, Johnny popped back up and kept going, I'm more likely a coach is going to move on. Okay, Johnny looks fine, keep going. But what's going to happen is the athletic trainer is just going to keep watching Johnny. And when Johnny comes off the field, if there was no signs and symptoms present, Johnny comes off the field, someone's going to, athletic trainer's going to ask, and they're going to know that kid, opposed to, say, roughly an EMT on the sideline that a middle school hires to come sit at a game in case somebody breaks their leg. Well, that EMT doesn't know Johnny from Adam, so there's not a relationship there, and they're not going to know that something's a little bit different. Something's a little bit slower. So it's a relationship building. So I got some different thoughts from different athletic trainers around the country. And how do you do that? You just go on Facebook groups, because that's what people do. And so I'm not going to read all these, but what it comes down to is that, and I'll read the first one. Mike Hopper's: relationships that we have with our athletes allow us to recognize the changes in behavior and moods, while medically differentiating those signs and symptoms from concussions and other concerns. And what it comes down to is we know these kids already, which is fantastic. The other part of that is that we're usually the first person to see it happen and the first person to evaluate that concussion. We're usually helping that concussion get sent off for referral, and then working with that physician for return to play and providing the feedback to that physician on how that kid's doing. At the same time, providing feedback to and working with our concussion management team on campus. And I'm going to get to that really shortly because I know that's going to be super important for us to talk about, so I'm going to fly over there. So what it comes down to is we have relationships. We're the first one to see it, and we'll just work our way through the whole process of it. I asked the coach, and again, I'm not going to read word for word what it says. You can feel free to read it. When it comes down to him as a coach, having an athletic trainer right there, it takes off what he really needs to what he really needs to work on. It takes off the pressure off him, and he gets to work toward his job and not worry about the injury. Someone else can deal with that. Heat of the battle. So what happens when we have an injury? You know, we have signs and symptoms of an injury. I don't have to go through those. So say I'm at I'll just use football because it's easier right now in football season. You get a kid injured. We have signs and symptoms of a concussion. We can use different schools. And here's the SCAT-5 I talked about having a tool to use for an evaluation. So I'll use an evaluation on the sideline. And there's other options for it, obviously. But that's one tool I would probably use. Here, I had to include this clip of Dr. Keister here. Why? Because he's a mentor, he's a friend, and he's a leader when it comes to concussion management. But yeah, it's a hokey little thing. Whenever I think of the words, when in doubt, send them out, I think of Dr. Keister. So we're going to say we have a kid removed from play. They're going to be evaluated maybe by the athletic trainer, maybe at a Friday night football game. I have a physician who's there too. We're going to monitor that kid post-injury. They're not going to return to play, and we're going to have some decisions there. You know, they're going to have to go right now. Are we having some deterioration in symptoms, some red flag signs? More often than not, I don't have those things, so we're just monitoring kids. And we'll talk to parents about it, giving them a rundown of things to look for, what they should do over the weekend. Again, old practice, going back to the dark room days, we used to say, okay, you need to rest, and you need to go in a dark room and do nothing. Don't stimulate your brain at all. It's a brain injury. Don't do this. Don't do this. Stay off your phone. What we're really doing is we're getting more into a prescribed rest. You know, you can rest over the next couple of days, take it kind of light, don't do too much, but then we're starting to gradually get them back into exercise pretty well. You know, a sub-threshold aerobic, maybe getting on the exercise bike, moving around. I'm just getting favorable recovery. And honestly, we started doing it a little bit before we were getting told we needed to do it because it was working. We were getting kids who were athletes used to moving, go, go, go. Well, no, we're not pushing them back to hurry up to get back, but we're getting them moving and safely. It's not something that shouldn't worsen symptoms. I don't know why I did that. Oh, anyway, rest, goal, returning them to school soon. I want normalization of activities. If I can get a kid back who had a concussion and they can come back if they feel good and they want to come to school the next day, I'm great with it. If I have somebody on Friday, that rest over the next couple of days is probably good enough for them to come back to school on Monday. I want them going through those things. They might not do everything that day. They might need to take some breaks, and we might have to we're going to put some school-based accommodations in there for some temporary ones in there. I want them coming to school, but not missing too much time. One of my least favorite things is just the general doctor's note, so-and-so suffered concussion, please excuse them from school for the next 2 weeks. It's not going to help them. We have a lot of things in place that we can do, so I need to get to those really quick for us. They don't like sitting still. It doesn't work. All right, no concussions are the same. We have, you know, a lot of times if I get a lot of symptoms, it's going to be a good predictor of how long our recovery time is, but not always. And you know, I might somewhere between 10 and 21 days is kind of an average for these kids, but not always. It's just what we've seen here in my practice. Again, active recovery gets them still moving. They have less anxiety with it. They're less depressed. It's great. Okay, super important thing is us as athletic trainers, we're working really hard with having some structure on how to return them back to play with steps, but being a little bit individualized per sport. And each of these steps is roughly 24 hours. We're going to start with step one of doing daily activities that don't provoke symptoms, like going to class. Then once we're moving down these steps, we get into some light aerobic exercises. We get some more sport-specific exercises. For football, we might have some harder training drills, passing drills, catching drills. We move them to a full contact practice and then back to sport. Yeah, there's 24 to 48 hours for these steps. So if I have a kid hurt today, they're not playing in next week's game, but they're not returning. You know, it doesn't put a time frame on it for what I'm trying to say. But once we're getting them going, we're able to step them through all these steps. I'll do some pre-participation baseline testing for these kids. And a lot of people are familiar with Impact. Is it the absolute necessariest tool ever? No, but I use it as a tool and it's helpful for me. I don't diagnose concussions with Impact testing, but I certainly use it as a useful tool to gauge and show how these kids are progressing with guidance with the physician here locally. It goes really well. We've had great success with it. Yeah, there's things out there saying that kids tank it and it doesn't go really well. But honestly, I think what happens if you structure it well, it works out really well. Here's kind of an example of sports-related concussion timeline. I'm going to move through that because I think what I'd rather do with the amount of time we have, we don't have a ton left. I'll let you guys, you know what, I'll fly through it. Thursday we have a kid hurt. They get, why this, you know what, I do want to talk about it. I get a girl hurt in a basketball game. They get looked at by the athletic trainer. They're removed from play. Talk about it with their parents. We put our concussion team into action at my school because I didn't get to talk about that much yet. And what that means is I'm going to put out information to who's on my team. I have and I'll talk about my team right here. My team is the athletic trainer, my school nurse, my school psychologist, an administrator, and a counselor. I let my team know that, hey, Johnny was injured. We're going to put these temporary academic accommodations in place, and they might be, I'm not going to go into specifics what they might be, and there's plenty of resources through CBER you can get them. We're going to put these accommodations in place for them. In the meantime, the referral is going to happen for that kid to see a physician, and that physician, if it's maybe it's a concussion specialist, might put some provider-based academic accommodations in place. So then we can formally put those in place with our group. So what our team does is we're able to monitor and review what's going on with that kid in the classroom. That kid's going to be able to come to the athletic trainer at the end of the day. I'll talk to them about how class went. Are you having any issues? What specifically were those issues? Is there some symptom triggers that are bothering you? And then if we can identify those things, we can then modify what our accommodations are based on what our symptoms are. So if the just sitting there still staring, if they're in a lab that they have to work computer stuff and they're having to stare at the screen too long, well, we can built in breaks for that person, or we can, I'm not the huge, let's give them extra time on everything, because extra time just builds on each other and then you bury a kid. Maybe we can pick out things for our accommodations where we pick key things and we can it's a word I really wanted to use. We can make key things and we can test off those things and check off a list of what we have to get done, but what's not just excess for them to just go and go and go. So I think the key when it comes down to is having a team that can monitor those things. So like my administrator makes sure it happens. If we need support, my school psych is very helpful with testing areas and school, the progress. My school nurse is super helpful. When it comes down, I need teacher buy-in at the same time. I need my teachers to be able to, my counselor. My teachers to be able to buy in and go, okay, well, what do I need? If my teachers need help, we're able as a team to provide some structure to them, give them some resources for them to, okay, differentiate instruction for those students, because they're differentiating instruction for every one of their students based on, it might be 504 plans or IEPs. They're able to make some changes for the PE instruction as well. So anyway, so we get that concussion team in action. I'm going to see that kid every day. We're going to refer him to a specialist. We're going to begin some light cardio activity maybe by Monday. This is just a rough estimate, guys. Over the next several days, weeks, we're going to see that. I'm going to see that person daily. We're going to record their progress. We're going to have classroom check-ins as our TBI team. We're going to check in with those teachers. Hey, how is so-and-so doing? This is what they're telling us. Do you need some resources? What can we do for you? And then we begin that return to play protocol we talked about, maybe take some neurocog testing again if needed. And then we're going to get them back to play through best practices, seeing the athletic trainer and the doctor, and getting them, making sure they're fully back to academics before we're getting them back into the field. I want them fully doing everything in the class prior to. I can't give any reason why I have a kid playing volleyball again, but they're still only allowed to, they're taking all these breaks in classes because again, I think it's important if we're talking to school-based stuff, and I'm going to fly through these last ones. School-based stuff, we need to have good documentation. And when we get documentation, and here's a standard one here for Oregon that we can send out physicians. And what does it do? It lays out some best practices for the physicians. It gives an opportunity for us to say, hey, doc, this is what I see with Johnny right now. And then they're able to be seen, and then that physician can come back and start them somewhere on that scale on how they're doing, what they can and can't do. And we have sheets for when it comes to academic accommodations as well. They're super helpful. And understand, what does a date mean? If I have a physician And most of my kids see doctors that I know already, not because I'm sending them directly to them, because we have relationships with local physicians. But if I get a note back saying Johnny can come back to play on the 19th, what exactly does that date mean? Does that mean I can start the return to play on the 19th? He can play on the 19th? Well, he hasn't done this return to play criteria. It might say he can do the 19th, but he's still having to go through these steps. And as a school, we need to understand that we need to make sure that we're going through those processes. Just because the doctor's note says they can now do this, or they can return to play, doesn't mean that the burden's not off of us. We can't just put someone back into play because the doctor's note said they can play now. We need to make sure that person's still having signs and symptoms of concussion, that we're not putting them back into play. And I think there was some litigation that happened in Washington in the past, in the last couple of years, that put the onus back on the school, because they knew, well, the doctor's note said they can play, so let's put them back into play. No, we still knew they were having some symptoms of concussion, and that onus came back to the school. Talked about the team already. Again, when it comes to academics, we want them in normalization as possible. Scaffold our instruction. We can take apart tasks. It's super important for them. Let's not just make more time for them all the time. We can make goals, requirements. The kids have to be able to self-monitor how they're doing and be able to talk to people about it. But we need our counselors, we need our teachers, we need our athletic trainers. We need them asking the right questions on how they're doing. Not how was school today? School was great. No. Let's get a little bit more. Let's break it down a little bit. What areas are we having trouble in, and why is that area the trouble? So I think this getting teacher education, understanding on why is super important. I probably don't have time for my 2 scenarios, but I gave you a scenario on a concussion and a quick run through, so I'm going to get past those. Here's the one I'm going to stop with, and moving forward, only roughly 55% of schools have an athletic trainer. And when and some of these schools just have somebody who shows up on a Friday night because someone is hiring them to come out to do this. And I just don't feel it's not just enough. It's not enough. My volleyball kids deserve having a full-time healthcare professional at their school just as much as their football team does, just as much as that middle school down the street does. We can find ways to do these things. We need to make sure, and I'm sorry, I wish I had more time with it, because I could probably talk about this all day. We need to have concussion management teams at all of our schools. If your school, and I would suggest if you're a parent, a teacher, a educator, administrator, what is your school's policies and procedures on concussion? Who wrote those? How often are they updated? And who's the team? Who's guiding these return to plays? Is it, hey, Johnny got hurt at the soccer game Tuesday, he got a doctor's note so he can come back from his concussion now? Well, who's overseeing that? Who's understanding that kid actually is doing well in class? Are we losing kids, and kids who are A students are now C students because no one's paying attention to them? The whole purpose of us, when I got together with Melissa here at Seabird, we wanted to put together a team so we didn't lose kids in the cracks. Because what happens is, at first we were just knowing kids had a concussion in the sport, and when they were better from their headaches and getting better, kids were getting back to play because the doctor said they're getting better. But we weren't advocating for them in the classroom enough. So who's doing that? Does it need to be the athletic trainer? No. But why is the athletic trainer doing it? Because no one else was doing it. Is it your school nurse? Is it the 504 coordinator? Who is it? Find out who is doing it and who is. And if no one's doing it, it needs to be done. And we need to make sure we have policies that are in place and they're followed. There's nothing worse than putting together a policy and just not using it. Make sure we do. Here's a sample of just Oregon. All those reds don't have athletic trainers, but you know what? The kid over in Molalla deserves one. The kid at Sayus Law deserves one. Burns, I don't know who doesn't have one, but they deserve someone who's out there looking for them. Concussions involving science, folks. I am proud that you guys checked in with me today, because somebody else will come next time and have a better presentation. But I'm glad you came, because it's everybody has different perspectives, and I'm super proud that as an athletic trainer I was out here to advocate for kids, my profession, and just wanted to say thanks. If you want to ask me questions related to this stuff,
now's the time.
I'm going to see where this little go-to meeting.
Type it in the comments, and Amanda's going to read them out loud to you right now, so
cool.
You don't have to worry about that.
All right.
Thank you so much, Ricky. That was great. Our first comment and question is from Gianna Simon. She says, I'm confused by the education required to become an athletic trainer. It sounds very medical, but your degree is a Master's of Education. Can you explain more
Oh,
about the
okay.
education piece to becoming an athletic trainer?
Okay. Yeah. So when it comes to things, there's been a lot of standards changed with athletic trainers. But if I could say right now, this athletic trainer is going to be an entry-level master's degree. So if I'm going in to say I want to be an athletic trainer, I want to work with kids, sports related to injury, I'm going to go and I'm going to get a bachelor's degree, and I'm going to end up in a program that more than likely is tied to a master's degree, so it'll flow together. Or I'll get a bachelor. Say I get a bachelor's in and then my master's degree is in athletic training. That's where my area is. And yeah, it's medical. It has to do with it has to do with sport science, biomechanics, kinesiology, but it has a whole bunch to do with the actual medical aspect of evaluation and diagnosis and standard of care and treatment.
And this is Melissa. I'm gonna toot Ricky's horn a little bit. He's also double qualified. He has a degree in education as well, and I think maybe that's where some of the confusion has come from.
Yeah.
And that's been really great because he has a really solid understanding of return to play as well as return to learn.
Yeah, and that was based on thank you. That was
Yeah.
based on the fact that I'm in the secondary school. I'm an athletic trainer, and in the past, athletic trainers weren't required to have master's degrees, but moving forward, they all are now for new graduates to be able to become an athletic trainer. And I got my master's in education because I was in the school setting, and I thought it helped me understand a little bit more. And a lot of my passion comes towards concussions and getting the kids in the classroom the correct way when it comes to concussion stuff. So I thought it was helpful for me.
Yeah. Do we have any more questions, Amanda?
There's another comment. This is from Joanne Swisher. She says, I would like to see athletic trainers, coaches, and parents communicate with the school nurse when a student is diagnosed with concussion in sports. The nurse can be an advocate for the student if behavior changes, emotional changes, academic changes, etc. develop. The nurse can advocate for further academic testing if needed, help the student work through physical symptoms when they re-enter school, and help parents, staff, and students develop a 504 for academic challenges, if needed, to help the student succeed in school. Improvements in communication between nurses and athletic trainers is critical for student success.
Yeah, no, was it Joanne you said?
Yeah.
Yeah.
Yeah, I 100% agree. And honestly, I have a new nurse this year. In the last several years, her name was Joanne as well. Different Joanne. But yes, that was one of the first things that happened when I got to my school was me and my nurse ended up establishing a fantastic relationship. Mm-hmm. And she was on my concussion team, and she was able to do those. And if your school doesn't have one, it hasn't created a school-based concussion management team, the nurse absolutely needs to be part of it. However, the issue with athletic trainers is, for me, I work in the school setting. Some schools don't have athletic trainers who work for the building, and they're contracted out working with them. I want to see more athletic trainers in the building being staff members, so those people are more naturally able to communicate and feel like they're a part of a team together. I think nurses have a huge role in this, and I think I think I'm getting more and more nurses now who are more interested in this part because it's growing. And I think there's some fantastic relationships between athletic trainers and school nurses. And honestly, if you're a school nurse and you have an athletic trainer in your building, that athletic trainer hasn't reached out to you or is a clinical outreach, I think you need to reach out to that person and understand what's going to happen is you might get a touch of a pushback because people don't like to step on everybody's toes and, well, this is my area. No, let's find a way to work together. What can I do for you so we can make this team work together? Because it has to be a team effort. And Joanne, I absolutely 100% agree. If I didn't have a good relationship with my school nurse, it would make my life hard and much tougher. And honestly, my past relationship with my nurse, she's been able to reach out to me, and we've just worked fantastically together. So it's a relationship building, and it should be.
Yeah, great comment.
Thank you.
Amanda, do we have any others?
Joanne Swisher had one last one, and she said, can you provide templates from schools with concussion team policies to share templates to share with schools that are developing concussion teams?
Yes, we have a Model 1 on the CBERT website, and I can get that sent out to everybody who was registered. There's also ones on club sports websites that show their policies around teams. So we have some really great examples we can send out. Club sports and high school teams, both we have examples of. So I think what we're going to do is we're going to end there. If anybody has any questions, please feel free to email them to us at Siebert, and we will either answer them if we have the answer. If not, we will forward it on to Ricky and get the answer for you. I want to say thank you to everybody, and just a reminder that we have a webinar every month, and you can go on to the Siebert website and register for the upcoming webinars. We also are going to feature Ricky on a Facebook Live in about 15 minutes, answering some of our questions from Siebert. If you want to log into the Siebert Facebook and check that out.
Yeah, hopefully I might be able to even chat a little bit about the stuff that I kind of had to breeze over in it super quick. But yeah, I'd like to talk a little bit more about the school-based stuff, because I felt like I was able to give a little bit more of what we do, but not touch on as much of this area.
And those are some of the specific questions we're going to ask him. So on that note, we're going to stop the recording there.